From San Francisco, it's Grumpy Old Doc with Dr. Gene Bede.
Well, we certainly are living in interesting times in healthcare these days. How many folks have heard that quote before? May you live in interesting times. I've heard it quite a few times at either the beginning or end of some really excellent speeches by some really well-informed, well-educated people. And it's generally attributed to be a Chinese curse. You know, I don't have the heart to tell people that it's never accurately been shown to be a Chinese saying. It seems to have its origin with a Brit, Sir Austen Chamberlain, around 1936. But interesting times indeed in healthcare. You know, just like the Chinese quotation, I think if you keep saying something for 80 years or so, it can no longer be distinguished from the truth. And I hear lots of stuff being said and repeated about healthcare today. Mostly it's stuff that tells me how I'm supposed to think or I'm supposed to feel about current events. I see a lot less actual facts and good information being disseminated, especially about the realities of health and sickness and of medicine and of rich and poor and insurance and access and care and how they all fit together. How come? Because it's a complex subject. There's no simple answers. You don't see the opinion makers talking about it because they don't know about it, and to learn about it would be hard. Well, Grumpy Old Doc likes hard. So today, I've decided to go out and talk to a few random people on the street, see what concerns them about healthcare reform, and maybe give me a little hint about what kind of hard stuff people would like to know more about. So let's go out and find out. Tell us your name and where you're from.
Mona, Francisco.
Okay, Mona, and what we're asking people today is, how do they think all this stuff with healthcare reform might affect them personally?
Well, right now our premiums have gone up dramatically, but the repeal and replace doesn't sound like a great idea either in its existing format as far as we can see and we can read, because it does throw a lot of people off their healthcare insurance, or they won't be able to afford it. So that's not an answer either. Yes, it needs to be corrected, the Affordable Care Act, but the solution that was passed by Congress doesn't seem like that's the right solution.
Okay. Well, thank you very much. So what's your name and where are you from?
Brent, Fresno.
Okay, Brent. Our question we're having for people today is, there's a lot of news about healthcare reform. Do you think it's going to affect you personally? And if so, how?
Hopefully my rates will go down.
Okay. Well, that's a pretty good thing to hope for. Thanks for sharing with us today. What's your name?
It's Raj.
And where are you from, Raj?
I'm a citizen over here, but I'm from India.
Okay.
But I work over here.
Okay, and my question for you is about health care. How do you think health care reform is going to affect you?
Affect me because it's not good for after 50 plus.
Okay. If you're a little bit older, not such a great thing.
Not a great thing.
Okay.
It's not good for the lower income people. And it's not good for the younger preconditioned people. And it's not good for the maternity or abortions or anything.
So coverage, rates, availability, these things all bother you about the new law. Thank you so much. What's your name and where are you from?
My name's Carrie. I live in San Francisco.
And Carrie, our question today is, how is healthcare reform going to affect you personally?
Me, personally, it will not affect. I have excellent health care through my employer, but I do feel bad for the number of people it is going to affect, have a negative impact on so many people.
Hi, what's your name and where are you from?
I'm Ginny, and I live in San Francisco.
Okay, hi, Ginny. Now, the question we're asking people today is about healthcare reform. Do you think it's going to affect you personally, and if so, how?
Yes, I'm on Medicare, but we have family members that have been on covered California, and I think they are all going to definitely suffer.
Okay, thank you so much. What's your name? Where are you from?
John. I'm from California. Yeah.
Okay, very good. Where in California?
Daly City, California.
Okay,
yeah.
And our question today is, how do you think healthcare reform is going to affect you?
Well, I don't belong to the Obamacare, but I do have Medicare, and I've been hearing that with the Obamacare, the price for the old people is about 3%, but with the new program, it will be about 5% higher, and then I'm not really happy with that for the rest of the people.
Okay. Well, thank you very much, John. Hi, what's your name? Where are you from?
Hi, my name is Stephanie. I'm from Los Angeles, California.
Hi, Stephanie. And how do you think healthcare reform might affect you?
I am currently a third-year nursing student, and looking forward to my career. It will affect my everyday life in taking care of patients.
Okay, well, thank you so much. And so today we're talking with, what's your name and where are you at?
Donna from Fresno, California.
And Donna, the question we're asking people is, how do you think healthcare reform will affect you?
Well, I'm mostly concerned about several things. One is the pre-existing conditions. Currently I'm insured, however, that can change, as we all know, and that would be a significant issue. The other areas that I'm concerned about are family members that have the current Affordable Care Act provisions and the Covered California, and if that funding goes away, then they will not have access again, and that worries me.
Yes, I think it worries a lot of people. Thank you. So we're talking with, what's your name and where are you from?
Mike from San Francisco.
Okay, Mike, and the question we're asking people today is, how do you think healthcare reform is going to affect you?
Negatively, mostly because I work with a lot of patients who have health care, and some of them from the Affordable Care Act, and I think that many of them are going to be in trouble.
Okay, well, thank you very much. Okay, so we're talking with your name and where are you from?
My name is Isaac. I live in Hayward, California.
And we're asking people the question today, how do you think healthcare reform is going to affect you?
Well, it's difficult to say at the moment because basically we don't even know what's in the healthcare bill, for one. And then two, it's like more like a bottleneck approach that they're going about the whole thing because they don't want people to know about what's in it in the first place. So we can't comment, we can't assess what the outcome is going to be on the long run, on the short run. We can't do anything. So we're kind of like behind closed doors, basically.
Okay.
So, to respect to how it's going to affect me directly, I have healthcare coverage, and I hope it doesn't have any negative effect on my coverage at the moment. But overall, like I said, it's difficult to comment because there's no transparency in what they're doing.
A lot of fear of the unknown.
Yeah.
Okay, thank you. Can you tell me your name and where you're from?
Elizabeth, and I'm from Seattle, Washington.
Oh, okay, Elizabeth. Now, there's a lot of hoopla about healthcare reform. How do you think it's going to affect you?
Well, I have type 1 diabetes, so there's a lot of costs with insulin every month, insulin pumps, machines, and so healthcare is very, very vital for my survival, essentially.
Okay, well, thank you very much. Who are we talking to? Your name and where you're from?
Penny, and I'm from Sacramento.
Okay, Penny, and the question we're asking people today is, how do you think healthcare reform may affect you?
Well, since I'm on state Medi-Cal, I'm thinking it might have a big change in how much we have to pay for our co-pays and actually where we can go for our health care, and that's already a problem, so it might get worse.
Thank you so much.
Well, what are some of my takeaways? I learned a few things. Healthcare is really important to people. No one said, no, it has no effect on me or anybody I know, and it makes no difference anyway. People are pretty compassionate. Almost everyone who I talked to who said, no, it wasn't going to affect them, said they were concerned about its effect on others. I did not hear a lot of positive thoughts about things getting better in healthcare. Instead, I heard fears that things will get worse. Maybe the exception that premium increases going forward may be moderated. But what do people fear? They fear losing coverage. Even people with employer-based health insurance don't seem too sure about it going on wonderfully forever for them. Will they be able to afford whatever plans are available? What about pre-existing conditions? What will their out-of-pocket expenses and cost-sharing be? Where must they go for health care? And how long must they wait? By the way, I'm going to do a whole show on the issue of appointment wait time. It's huge. And let me tell you right now, virtually nothing is being done to measure it, demand it, improve it, reward it, or regulate it. And finally, I want to repeat, and I learned this again. It reinforced my learning from my interviews. It's a complicated issue. So complicated, and you add in the level of partisanship that's been injected, and I think there's a feeling among some that this is not on the level that healthcare reform is kind of a put-up job. It's not transparent. Well, maybe there's a few things I can address in the last few minutes of our show today. Pre-existing conditions are one of those things like appointment availability. I think they demand the whole show. The complexity and opacity and partisanship,
I need someone on this show with more Washington savvy than me, so I am going to be looking for that guest to dissect those issues with me. One quick clarification I can make is about what happens to older people with individual coverage, like on the ACA. The costs are going up, and it's not exactly 3% and 5%, it's 3 times and 5 times the premium amount. I'll talk about that in a minute. But consider how really well and informed and articulate everyone is. That 3 and 5 number stuck in people's heads. I did not hear total nonsense or outright misinformation from anyone, but I did hear that the issues of cost, complexity, and concerns about fairness repeatedly. So let me explain this. Currently, older people, and this is generally over the 50, because once you get into 65, as one of our gentlemen said, you're on Medicare generally. But other older people, currently, if they're getting individual health insurance, they only have to pay a monthly premium 3 times what the youngest person on the plan pays. Under the health care reform, that would be changed to 5 times. So let me put some numbers out here. I'm a young guy, I'm paying $100 a month for my health insurance. I'm an old guy, I'm paying $300 a month. That's the spread these days, 300%. Under healthcare reform, the young guy pays maybe $80, and the old guy pays $400. 5 times the amount. But the old guy's stuff goes up, the young guy's stuff go down. So is this fair to older people? Well, it does raise the ugly possibility that some people get priced out of this market. And so economic and coverage concerns for people over 50 are pretty obvious. But there's a flip side. And just like in a record, sometimes the flip side gets airplay. In this case, it really hasn't gotten a lot. Under any circumstance, young people pay more than they consume as a group. And older people consume more than they pay. That's the nature of insurance. If you perfectly match what you pay to what you consume, some people would pay nothing, some people would lose everything. That's why you have insurance. So people with low risk pay to avoid that risk and subsidize the people with high risk when they happen to have a problem. Okay, so where do you set that needle, though? What's fair in terms of how much more should an older person pay? You know, I hear very commonly among millennials who go bare, they have no health insurance, they'd rather pay a penalty, is that the insurance is too expensive and they don't get sick anyway. So the thought is maybe cheaper insurance would get more of healthy young people to enroll. If that would happen, it would stabilize that insurance pyramid, make the base broader to support the older, sicker people at the top. Is this screwing older people? Like I said, it's tough to figure out where to set the needle. I'm a little more concerned about how the older generation, my generation, is screwing the younger generation. You know, Warren Buffett has been on Medicare for over 20 years now. The elderly have largely become an overall more affluent demographic than the young who can't even afford to buy a home. And yet, as Social Security and Medicare are currently structured, they're going to further deplete the resources made available to my kids as they grow old and sick. So this is a real issue, but is it bad? Well, it really depends on who you are, where you stand, how you look, and what you're looking for. I want to talk about a second concern raised about Medi-Cal, or as the rest of the country calls it, Medicaid, drastically changing. You know, that can happen in a number of scenarios, and some change is likely to occur no matter what. But changing Medicaid to a block grant program is what many people find most controversial. To review, under a block grant, states like California just get a big pot of money for the feds to cover their Medicaid programs, and they can spend it however they like. The idea behind it is that individual states are more innovative. Their populations are different. You would want perhaps a different solution to cover the poor in Vermont than in Texas. The reality is that states cannot print money like the feds can. And so if Medicaid exceeds the state budget, it would now be entirely up to the state to figure out how to curtail costs. I don't think it's unreasonable to expect that it'll be more difficult to qualify for Medicaid. There'll be less recipients. They will have higher cost sharing. Their benefits will be reduced. And the number of doctors and hospitals that they can use will be reduced. But you know, the status quo sucks as well. Earlier this month, I got a birthday present, 1,400 pages of reading, the so-called mega regulation from Washington.